and welcome to Setting Boundaries for Healthcare Workers. All participants are muted and unable to turn on their microphone. Today's session is being recorded. The slides and recording will be sent to all participants within 5 business days. We do not offer CEUs. However, you can receive a certificate of attendance from the link emailed with the materials. Please use the chat box or the Q&A function with any questions. Also, please feel free to call out where you're viewing from in the chat box. When using the chat box, please make sure that your message is set to the correct audience, either panelists only or general. Today's presenters are Sarah Reed and Julie Collis. Sarah Reed is a community psychologist by training and the current program and evaluation manager for Rogers in Health, the Education and Advocacy Department of Rogers Behavioral Health. Through InHealth, she works through partnerships to reduce the stigma associated with mental health challenges, trauma, and substance use. She is also the STAD to the Wisconsin Initiative for Stigma Elimination, a statewide coalition focused on building inclusion, support, and hope for individuals and families living with mental health challenges. Julie Collis is a licensed clinical psychologist with an established private practice on the Upper East Side of New York City. She provides evidence-based treatment such as cognitive behavioral therapy and mindfulness-based cognitive therapy for a range of mental and behavioral health challenges. In addition to her clinical work, Dr. Collis is an adjunct clinical supervisor at both the Sarakoff Graduate School of Psychology and Fordham University's Graduate School of Education. Dr. Collis is a proud editorial advisory board member for the PsyCom and PsyCom Pro subsidiaries of Remedy Health Media. She is also pleased to be a Lenox Hill Hospital Northwest Health Auxiliary member, where she supports continuing education for nurses and staff and enhanced technology and equipment for patient care and more. In addition to her clinical work and teaching endeavors, Dr. Collis serves as a consultant to healthcare technology companies. With that, I'm going to hand it over to Sarah Reed.
Fantastic, excellent. Thank you so much for the introduction, for having me here today. It's fabulous to see so many people joining us and sharing where they're from in the chat window here. Fantastic to be here sharing some of our content related to compassion resilience. So as mentioned, I work at Rogers Behavioral Health, and I'm based out of Wisconsin. And for the past 2 years or so now, we've been offering to communities, both in healthcare and school sectors, our Compassion Resilience Toolkit to try to grow people's sense of compassion resilience, doing the work that they do, and to stave off burnout and compassion fatigue. And we are excited to share some of that content with you today from the perspective of this time that we're in related to COVID-19 and some of the unique aspects that it brings to those who work within healthcare fields. And so, as mentioned, I represent WISE, the Wisconsin Initiative for Stigma Elimination. We are a statewide mental health collaborative that brings together people, families, and advocacy groups with lived experience to develop and share and evaluate evidence-based practices related to a decreasing stigma related to mental health, or rather to increase inclusion, hope, and support for people and families living with mental health challenges. And we get the question sometimes, why do you do work related to compassion resilience if you are the stigma reduction group or the stigma reduction arm of a mental health facility? And what we found was that when doing inventory as to where people experience stigma, 2 of the places that they're most apt to do so are within healthcare and within school settings. So some of the very places in which we're hoping for a compassionate response and to reach out for help and support, we're apt to experience really hurtful or biased or uncompassionate responses that may then limit our interest in going to healthcare in the future or accessing other forms of care. And so really pivoted to try to support the work that compassionate people are already doing, and try to build that sense of compassion resilience to have people show up their best selves and as consistently compassionate as possible. So just a little bit of background. I'm going to share in the chat window here where all of our compassion resilience content can be found. We have a website at compassionresilienceToolkit.org, where what I'm sharing with you today can be publicly and freely accessed, and you'll find a wealth of additional resources there as well. I am only going to share with you an appetizer-based portion today of what our content covers. First, I just want to start us off with a bit of a mindful pause. I found in doing these webinars and these virtual trainings can be helpful just as a means of transitioning from one thing to the next, or just to take a little bit of a break for ourselves. And so I urge you just to get in a comfortable position and take a few slow breaths. Think of in your mind what it is you need to let go of for the time being to engage as fully as possible during our next hour together. And maybe your intention for being here today. Take a few more slow breaths if you would. And then I invite you back to our large group as we proceed with our content here. I'm sure for many of you, this hasn't gone unnoticed, but we are living in an unconventional, precarious time, both in terms of what's going on with COVID-19 and politically and in regards to social justice challenges. And it really has resulted in some decreases in people's mental health and to higher prevalence rates of mental health challenges. And so I share with you just first of all, the mental health continuum here to just recognize that for a number of us, we are finding ourselves in these realms of experiencing either poorer mental health than we might otherwise be experiencing, or than perhaps we were this time last year. Or if we aren't quite a person who has a mental health challenge that's diagnosable, still having some challenges related to stress and grief that can really compromise our mental well-being. And that is perfectly understandable in this time, given all that is going on. And so just want no shame and blame if you recognize yourself in any of the slides I'm about to share related to burnout and compassion fatigue, because it is pretty endemic in our society even before all of this took place. What do I mean by compassion fatigue, first of all? So compassion fatigue, as I mentioned, is really pervasive amongst healthcare workers, also within school sectors, is essentially within anyone who works with people day in and day out who are apt to experience trauma or challenges or pain of some way, shape, or form. And so those of us who work with people right now, that's probably us. And that's the unfortunate reality for many of us at this time. And so compassion fatigue is really the intersection of burnout and secondary trauma, or hearing those stories and then feeling ill-equipped perhaps to respond as effectively as we might like to do. I reference here the ProQual as a survey that is a form of self-assessment where you can check in with yourselves and see how you're doing regarding your compassion fatigue, compassion satisfaction, or burnout. And what we found is that over time, when we experience fatigue and it becomes more chronic, that we as individuals and as colleagues and as caregivers tend to decrease our sense of compassion over time. And we have an innate want and desire to help as people who have found ourselves in this field or who are called into healthcare. And yet if we're facing burnout and compassion fatigue, we may not show up as effectively and compassionately as we might otherwise do. And so this can decrease our sense of empathy, can make us less effective in our roles, and getting real, it can also really decrease our sense of joy in the work that we do as well. This can then translate into our personal life and our life at home as we start to bring home more of those experiences and feelings. Harder to maintain that work-life balance. And then it can also decrease our mental health as well, as that last slide related to the continuum really elucidated. Seeing some recognition of the ProQual there in the chat window. So glad to hear it's been in use, and I absolutely suggest you take a look at it. What might compassion fatigue look like, either in ourselves or those around us, or perhaps in our colleagues? Well, we find it starts much sooner typically than we anticipate, and so tends to rear its head, first of all, when we're a new employee, or when we have just gotten a promotion, or something new arises, as we get really excited and we enter this sort of zealot stage of our life. This is where we raise our hand a lot, and we always want to be the first one to jump on a new committee, or to take the patient who's a challenging case, or where we're just more apt to say yes than perhaps assessing some of our boundaries and our own realities for ourselves. And so we might start off in this zealot stage here, and then as we start to see some of the cracks in the system and some of the challenges that we're facing, and as we start to see people existing in the world in ways that perhaps are in conflict with our own values, or what we know of our own selves, or of healthcare needs for our community, we start to get a little irritable. And I don't know about you, but I have been in this irritability stage as of late, as I've seen people perhaps not taking care for public health as much as I would like, or valuing it to the extent to which I do myself, or I advocate for those around me. And this can start to breed a sense of hopelessness or helplessness, feel a sense of anger or disconnection. I know I can tend to be kind of cynical, and start to look towards the future with perhaps a little bit of less hope than I otherwise would. Staying in this irritability stage for too long, really common thereafter to start to withdraw a little. Maybe I don't connect with people as much as I otherwise did. Maybe I'm distancing from myself from some of those people with whom I have some differing values. Or maybe I'm just starting to get really tired and exhausted, and starting to feel some physical ramifications of my chronic stress, or of the experiences of my day. And so at this stage, we're apt to get sleepy. If you're in a work setting, perhaps you are late sometimes to meetings, or starting to become absentee, or have a sense of presenteeism where you're there, but you're really just going through the motions. You're in and out the door more for the sake of the paycheck than for connecting with people. And that sense of withdrawal can lead us to feel really disconnected. Staying in that stage, then we might become a zombie, where we feel a little bit of an overinflated sense of self. We start to really doubt whether we can make a difference, whether we can help people. We are anxiety ridden, perhaps, and this can result in sleeplessness, some manifestations of stress, thinking others are out to get us, or perhaps if we're talking about with our families, it's that we're there, but we're not really connecting. We're not really having quality time. So in these stages of fatigue here, really common, once again, that people experience these, and hopefully we can do something about it, which is where compassion resilience really comes in. So let me just pause here to remind you, if you see yourself in these stages at all, it is a really common experience. It is a common response to really complex circumstances, such as those that we're currently facing. Heck, it's a really common experience without the added stress and challenges of the time in which we're in. And so I'm seeing in the chat here that a number of you can recognize yourself, or perhaps your coworkers, in these stages here. And I myself seem to zip around from stage to stage throughout the course of the day, or maybe over the course of the last couple months for sure. We don't want to hang out in them for too long. One, because it can compromise our own mental health, our own ability to show up compassionately with and for others, but then it can also impact those around us. And so I talk about these stages as if it's an individual response. And yet, if we're on a team, if we're on a treatment team, or we're working as part of a unit or in a clinic together, you can see how if a lot of people are withdrawn and irritable or zombies, those zealots try all the harder to pick up the flack and to be helpful. And then starts again, that vicious cycle with those who are in that zealot stage. So this is normal. Particularly in what we're experiencing now. And so this is not a means of shaming or blaming. I just share that really to level set us, to share some language around compassion fatigue, and to share that this is a universal experience for many of us now, particularly in the healthcare fields or in the behavioral healthcare fields as well. And so want to just recognize that fortunately, there's quite a bit that we can do about it. And my intent for the rest of at least my presentation time is to share some of the different strategies and tools that are shared as a part of our Compassion Resilience Toolkit, and to explicitly focus on the connection between our ability to build and sustain healthy boundaries in its relation to compassion resilience. What do I mean by compassion resilience? Again, want to level set here. The basic sort of dictionary definition is this first one: the power to return to a place of empathy, strength, and hope after the daily experiences that our clients or our patients, our families, or that we as caregivers tend to face. I want to emphasize a few parts of this sentence here. The power to return to a place. We really believe that people's, for the most part, innate sense in the healthcare field is that of empathy, strength, and hope, is that of a compassionate person or someone who aspires to show up and act with compassion. And yet, day in and day out, when we have challenging situations in families, in patients, a top burnout that comes as a function of our jobs, again, can really fall into that trappings of compassion fatigue. This second definition is the one that really sits so strongly with me. So compassion resilience really requires that we find optimism in an imperfect world. Now, this is hard for me. I know from my own EQ scores that optimism is something that doesn't come naturally to me. I tend to need a lot of evidence, as many of us research types do, to feel a sense of optimism. And yet, something is compelling me to get up, to get out the door if I am working outside the home, and to go to work. And it is that driving sense of optimism to be able to make a difference, that driving sense of optimism, I can make it through this, that I can support my family through this, that at the end of the day, despite the challenges of fatigue, that I can help those around me in some way. Also emphasize this imperfect world because we do see drivers of fatigue externally right now, probably more than ever for many of us. And yet we also work in imperfect systems. And so I need to recognize that there are some system drivers of fatigue as well, and that we need to continue to also find the optimism to work within imperfect systems as well. Now, the core of our compassion resilience content is really based around team-based approaches related to having really courageous conversations, to really developing that sense of connection between one another, either between coworkers and colleagues, or if it's within the family and caregiver toolkit, to developing those connections and having those courageous conversations within our family units. And so we start really just with level setting. What does compassion even mean in terms of an action? Because it's far more than a feeling, or it's far more than a value. It is a way of showing up in the world. And then we have these next sections are really based around developing team or healthy culture type agreements and behaviors and ways of being together. And we'll go through what that core content is that's by and large where that aspect of having boundaries really comes into play and is really necessary. And then we do have some wellness-based strategies at the end of our toolkit and woven throughout as well, but we purposely have that material last because we think it really unethical to point and say we need to engage in better self-care and take care of ourselves and nurture our own well-being if at first there aren't the strategies and tools in place to help support our individual well-being practices. I know at Rogers we tease that if HR wants us to go and get our steps in every day, that we first need to have policies and practices in place to help us develop a work-life balance to get those steps in, or to have time off throughout our day in a meaningful enough way that we can take advantage of going outdoors to do so. And so we really first of all focus on establishing those environmental or cultural type changes that need to take place so that, again, we can support our own well-being. What do I mean by compassion now? And this might seem old hat to many of you, and yet I'm going to be frank, we have found across different sectors of communities in doing this work, even for those trained in behavioral health, that this can be really hard to do. It can be hard to do on a good day. I need to first notice that somebody is struggling and is hurting. And my ability to notice can easily be compromised if I'm hurting too, if I'm facing some kind of challenge as well. My ability to notice can be difficult at the start or end of a shift. It can be compromised if I'm working from home and there is a lot going on and children running around and having their certain needs that they need to meet. If I'm someone working virtually, my ability to notice is compromised by a function of not being able to see everybody's face and having to infer more through tone as well. So this first step can be tough in and of itself. Then I need to engage in some sort of inner self-check, because let's face it, we all have some kinds of biases that we come into this world with based on our previous experiences or our values that can be really uh, barriers to our ability or willingness to connect with others in an empathetic, compassionate way. Now, I'll be honest in that I am a very firm advocate of social distancing regulations, of wearing masks, of abiding by CDC and World Health recommendations, and yet I see a number of people around me for whom that isn't the case, or they're acting and behaving in a way that is different from the way in which I am. And so in order sometimes to connect with people with whom there might be some sort of value conflict, needing to turn inward and check in with myself is a necessary step. And you know what? Again, I'm going to be frank. Sometimes, and here's an element of where boundaries come in, sometimes my self-check tells me now is not a good time. Sometimes my self-check tells me I need to postpone this conversation, or I need to do this when I'm in a little bit of a better place, or I'm not the one right now who can really engage with this person in the most compassionate, meaningful, effective way too. If I can be that person at that particular point in time, then I can try to really learn what's going on with them, learn more about context and observation, seek to understand. And we're not looking just for all the details. We're instead looking for the feelings underlying the experience. We're instead looking for strengths, because that can then help compel us forward into helping those people access their strengths in moving forward. As I seek to understand and learn more what's going on underneath the surface or behind people's motivation to act or behave in particular ways, it can help me to develop a sense of empathy. And I don't need to empathize with someone's experience. I don't need to have gone through the exact same thing to feel a sense of empathy. Instead, I need to be able to connect to those feelings that are underneath, to a shared sense of sadness or frustration or fear, or something that's really undergirding the experience of the person at the time. And that's typically easier than to find some common ground and common humanity as a result. And then when doing so, we can help to co-plan and find a way forward together. This is not about giving a solution or going into fix-it mode, which might be my natural tendency at times. Instead, it's to help people access their own strengths and their own wisdom, and to really believe that they have it within themselves to find their way forward. And so what's really key here is not giving ideas or not saying what's worked for me in the past. If I ever do want to give advice of some kind, it's really advisable that I ask, I have some ideas right now. Would you like to hear them? Or, you seem to really be stuck right now. Would you like to hear some alternative approaches or ideas, or what I'm hearing? So this is that concept of working together. and building that sense of camaraderie rather than trying to find a quick, easy solution for people. And then lastly, it is not compassionate if we don't take action, if we don't follow through, if we don't do this final step and engage in the promises that we made during step 5. And so really want to urge you to take this to heart and recognize that it's challenging. And yet when we aren't able to abide by these approaches, it can really compromise care, can compromise our relationships with people. It can inadvertently suggest a sense of stigma for people. And it can, again, not feel really good on our own selves if we didn't show up as compassionately as perhaps we would otherwise like to do. So I want to pause here and then ask you to engage with me with the chat window here. What might make you feel that way? What might make you feel a sense of either a lack of compassion or a lack of ability to engage in those compassion and action steps? This is what we refer to as our drivers of fatigue. And so if you could just populate the chat window there with what drives your fatigue or drives your sense of burnout, I'd appreciate it. Seeing frustration, grief, lack of self-care, system barriers, nonstop work, long hours, challenging patients, too many meetings. Oh, absolutely. We see a lot of really similar responses regardless of whom we're asking. And yet there are certainly some drivers that are really unique to healthcare and to frontline workers at this time. Too many Zooms, for sure. Inability to meet in person that can drive that lack of connection, certainly. And as you're populating these in the chat window here, there are some of these around which we have control, and there are some with which we don't have much control. And there are some drivers of fatigue, many in fact, around which developing boundaries or establishing boundaries might help to limit our fatigue. I'm seeing that a number of additional responses are coming in here, fast and furious. I want to take a pause here if we could. And next, if you wouldn't mind, what drives your resilience? What compels you to be compassionate and to show up in that way that I just described? What helps right now? Empathy, art, love of humanity, gratitude, like-minded people, part of a mission. Absolutely. We have found that some of the strongest drivers of resilience have been connecting to a sense of meaning and value and purpose in our work. Seeing recovery, hope, spirituality, faith, nature, meditation, sure, some self-care practices in there. Yeah. Lots of tools to aid us right now. And we have done this exercise with groups in various sectors of the community from a number of different walks of life. And we found that typically when we look at where we have control, we have a lot more control around the things that feed our resilience and drive us to be compassionate, and a little bit less control typically around that which feeds our fatigue. And again, one of the ways in which boundaries comes into play, which you'll see here in a moment, is that sense that our ability to have compassionate boundaries with those around us, whether families or patients or coworkers, can well be an anecdote to a number of drivers that we might otherwise think we lack control around. So I want to show you an example of how this was done in practice. This was actually with families and caregivers rather than with healthcare workers. But again, you'll probably see very similar drivers that are expressed on this page here. So those that are listed as drivers of fatigue, we asked then, where do you feel a sense of control around these drivers? And we might have a differing sense as to those. I might feel a sense of control around my finances as I'm in a stable job and I'm not wanting for a paycheck right now, whereas somebody else who's out of work or waiting on unemployment to come through might have a very different sense of control around their financial situation right now. So on this page, those in red tend to be the ones with which people often share a lack of control. Those that are underlined, there might be some disagreement or conflict related to how people perceive their control around some of these. And drivers of resilience, as you see there, far fewer in red, to indicate that we have typically a lot more control around the things that fuel our resilience and drive us to be compassionate people, rather than those which tend to drive our fatigue. Another thing I want to point out here is this last comment on the driver of fatigue: unrealistic expectations from others and from ourselves. And we see this interconnectedness between expectations and boundaries, because our means of establishing boundaries with those around us is really a key to knowing what to expect out of our relationships. So wanted to point that out as just one example of the interconnectedness between boundaries and some of the fatiguing drivers that we have here. And so this exercise is fantastic to do for ourselves or as a team, because it helps us to hone in on all that we do have control around, which is all the more important when we're experiencing a pandemic and social unrest, which day in and day out, the news is showing us there's a lot which we can't control. And so this can really help us to stave off some sense of anxiety, recognizing that there are some things that we can do for ourselves and for those around us. And so I mentioned that some of our key contents related to expectations, and expectations was not only listed on the last list that I showed you there, but it also comes up invariably in conversations, again, across sectors, with people who are struggling right now. Because whenever you go through a period of a lot of change at once, expectations go out the window for ourselves and typically for others. Can I be expected working from home to meet the same types of deadlines and workload and caseloads that I was when working in person? Probably not. It's probably not reasonable. Can I be expected when working from home and I have children in the background and trying to do homeschooling and my work commitments, to be as effective or as engaged as I would be if I didn't have those challenges? Probably not. And so this is a time in which our expectations are really in flux, and they're often really ambiguous. And by this I mean our expectations for ourselves, our expectations of others, and the expectations that are placed upon us. Now, typically we say that it's really ideal to have realistic expectations, to have some that are aspirational and that stretch us a little bit, and to be clear about them, to be really transparent with those around us as to what we expect. And this is why, whether we're in a work relationship or at home. Now, I listed on here the expectations are really related to the why, what, and how. Challenges with expectations really come from these three core places. Now, what do I mean by that? Well, I'll give you an example from Rogers. And at Rogers, there are staff who really struggle with understanding the expectations around much of our intake and documentation requirements. I'm sure that's pretty common in healthcare. And when we asked, what is the challenge? What's hard about doing this, or what don't you understand, or why do you think that you can't quite meet these expectations? We heard a few things, and it's related to the why, what, and the how. We heard some people saying, I don't understand why we need to do this because other people ask the same question, so it seems redundant, overload, unnecessary. We don't understand the what, so what are we supposed to be marking down for this question? What do you mean by suicidal ideation? What do you mean by assessing someone's gender identity? So there might be particular questions around which there are struggles. And then the how, like how much note-taking should I do? How in depth should I get this case study or this story, or what do you expect of me in terms of how much I do or how much time I spend with a patient doing this? And so once we were able to see where there was a discrepancy between actions and and the expectations, by addressing the why, what, and how, people were much more apt to follow through and to do so with a good understanding as to why that was the expectation. And typically, whenever there is that discord regarding expectations, asking about the why, what, and how can be really lead to some insightful conversation around which you can start to make some meaningful change. Boundaries. And so this connection between expectations and boundaries is apparent in a couple ways. I've listed one of them here on the slide, but boundaries really help us to know what we can expect out of our relationships. Can also help us to hold people accountable to meeting expectations in our relationship. And I'll hark back to that concept of that self-check, but boundaries, if we're engaging in our self-check, might become all the more apparent if we're mindfully aware of our feelings or our own needs, and then to communicate to others our expectations of them or our needs for them. One more chat in, if you wouldn't mind, before we move on to the boundary segment here. We also ask people, what does it look like when you're at your best, whether within your family or in a workplace environment? Because we can make actionable ways in which we can hold one another accountable to a healthy culture or environment or team if we have clear expectations, and then through setting boundaries, hold people accountable to meeting them. So the image that I have on the screen here are some family at its best type of ways of engaging with one another. But if you could, share with me some helpful behaviors from your workplace. What does it look like on a team or a unit when you're operating at your best? And I mean, get really specific if you could, because we could say be polite or be respectful and then go back and forth all day as to what that really means. So instead, what does that look like, sound like, feel like? Listening, showing compassion, being understanding, real-time communication. Yep, coming prepared to participate. Lots of ways that we can show up in healthy, helpful ways with and for one another and together. And if we expect those behaviors of others, I bet we expect those behaviors of ourselves as well. And so keep sending them in if you would. We see a number of very similar ways of being together that tend to lead to effective, compassionate teams, and I'm seeing a lot of those ideas coming through the chat window here. Yeah, absolutely. Awesome, thank you. I love your list. If you're able to create, say in your workplace, a list of healthy cultural expectations or behaviors like we're doing now, which is what we've been able to do at Rogers and elsewhere, then through the use of healthy boundaries, we can hold people accountable to meeting them, and others can do the same for us, which can make us more effective in our work and hopefully more apt to be compassionate and work in healthier workplaces as well. I'm trying to advance my slide here. All right, so as promised, let's do this connection to boundaries here in the next couple minutes. Brene Brown is one of the gurus of our compassion resilience work, and this quote is our favorite throughout our toolkit content, and it has been so impactful to me. Compassionate people ask for what they need. Oops, pardon me, I'm having a slight challenge here. There we go. They say no when they need to. They say yes and they mean it. They're compassionate because their boundaries keep them out of resentment. Now, ever since hearing this, I have found resentment in myself. I have experienced it, and I have been able then to do my self-check and say, what didn't you set a boundary around, Sarah? There was something within my realm of control that I could have done or said in order to keep me from that place of resentment, to keep me so I could continue to have the relationship with the person with whom I'm engaging be a little bit healthier, a little bit more transparent, and a little bit probably more compassionate. What might that look like to set those boundaries then? And so we've developed this set of compassionate boundaries and how we can go about doing them. We need to first know what we want to say yes to, and our yeses align with our values and our priorities and our mission. And so back on that list where I asked you to come up with those ideas as to what constitutes a healthy way of being together, that's what you want to say yes to. And that's what your colleagues want to say yes to. Because when we can say yes, it might take a little bit out of the sting out of our nose. We want to be proactive and say things in the moment as they arise, because we don't want to have that resentment breeding. So what's an example? A quick example here is that I'm someone who uses a little colorful language in my home life. If perhaps I had been doing that with coworkers or colleagues and they took offense to it or didn't find it respectful, and they didn't proactively share that with me for months on end, I might be a little bit hurt that they felt they couldn't come to me with that, because I would have changed course had I known that. So I want to be proactive as soon as it comes to our attention that it's something that doesn't sit well with us. And just say it, be direct, don't make people guess, is what we like to say. Reinforce it in the moment. So immediately, if we notice that somebody's violating a boundary that we've established, want to reiterate it so that we don't continue to either grow in that resentment or get taken advantage of. We want to give relevant explanations to the person as well. And on the next slide, I'll share some examples of what that might look like and sound like. And then you have to back it up with action. At times there will be people who violate your boundaries repeatedly, and then need to know at what point it's time to move on, or that you need to change the degree to which you interact with people in a certain way. I know when the pandemic first started, this came about as people were deciding for themselves how much social distancing to engage in, and so needed to establish some boundaries around family, friends, and neighbors as to what they considered in their best interest, health-wise or professionally or for their family. A couple examples on this next slide of how you can say yes regarding your boundaries in reference to your nose. And so this first one here is, you want to limit your social interactions with others for the sake of your health, to protect my family's health. That is my yes. I'm no longer having visitors over or meeting with people. Perhaps we could have virtual meetings instead. And so that last part, that virtual meetings, is offering a relevant alternative for that person. Saying no to extra commitments here. Our goals are important, but then I need to discuss what can come off my plate so that I don't get burnt out, because I'm trying to balance my family's needs and my workload as well. And so another example of how you can share your no's, your boundary language, while encompassing what your values and priorities and your mission are. Harder to come back then and be argumentative or defensive when that's the case. So a couple just key takeaways here I want to share with you. What can you do hereafter in response to some of these strategies that I've shared? Think about what boundaries you might need to set, either in your personal or professional lives, to get others to abide by agreements or what you establish as a healthy, necessary culture, whether a family culture or a workplace culture. Think about if in your professional lives, there might be a way in which to establish some agreements and some means of accountability. I know at Rogers that has been at the fore of our work, trying to have a standard set of ways in which we are together that has compassion at its core. And then what kinds of supports do you all need to live up to any agreements you may establish? And so again, those supports might very well be addressing some of those other barriers of fatigue. I don't have time to go through various wellness practices that are also a part of the toolkit. They're listed here, are ones that science suggests are really firmly related to our sense of well-being, our stress resilience, and our compassion resilience. And so if any of these interest you, there are tools and strategies within our toolkit where you can find additional concepts related to all of these. Perhaps as we shift gears here to our second presentation, if you wouldn't all mind just sharing something in the chat window here about which you're grateful, that could be a good means in which to transition while living out one of these wellness practices here. At this point, I am going to pause. I'm going to pass the mic. I'm going to, again, populate the chat window with where our toolkit materials can be found. If you're interested in learning more about particularly the boundaries segments, there are boundaries-specific sections of the toolkit content. And then there's also some blog posts as well as videos related to establishing healthy boundaries in the context of COVID-19 that I would suggest you take a look at as well. So thank you all. Appreciate your time, and I will also populate the chat window with my contact information if you are interested in reaching out to learn more either about trainings or our toolkit material here. And thank you for sharing in those ideas and those gratitudes.
Hi, I hope everybody can hear me. Thank you for the warm introduction, Madeline, and the opportunity to present. My name is Dr. Julie Colvett, and I wanted to say that repetition, or to remind everybody that repetition is the mother of all learning, and that there may be some overlap between the two lectures in today's workshop. I also realize that there may be some new people logging on today, so that's good too. Dr. Rossi did an excellent job, and I'm optimistic that the second part of this workshop will add to what I hope has been a positive learning experience for you all. I know it has been to me. I think I'm going to be talking about self-care. And on that note, I'd like us to stand up wherever you are and to take just a little stretch break, or sit down and move your hands and move your legs just to get the blood flowing, and maybe take a couple deep breaths, and then we'll collect and start in just a minute. Okay. Now, Dr. Ross, I wanted to also say that I'm thinking about you and your fellow Wisconsinites today. I appreciate your work and how you presented to us in such a clear, honest, and comprehensive way. I made some notes during your presentation, and I liked our family at its best slide, and I identified with what you said about how it can be hard to be optimistic in an imperfect world. All in all, I'm reminded that mental health, like physical health, does require effort. So to review, boundaries can be defined in a variety of ways. They often link back to values, opinions, and beliefs. I think a key takeaway from this slide is that boundaries link back to personal responsibility. Now, at this point, you may be thinking about a time when you effectively or successfully maintained a boundary, or even a time when you wish you did. This is good. Workshops such as this one, I think, can be instrumental in nudging us towards self-reflection, awareness, and monitoring. So if you haven't done so already after taking that stretch break, give yourself credit for listening today. Madeline, would you advance the next slide? Okay. So along the lines of self-reflection, awareness, monitoring, I'd like you to please look at this slide. Keeping in mind our subject matter, how does this image, the words written on the slide, make you feel? What thoughts does it stir up in you? Now, for the sake of time, I'm going to hold off on asking you to type your responses in the chat box, because I'd like us to have a chance to answer some questions. But I imagine if we did have the chat box going here, that this slide may be a little unsettling for some people. I mean, from my perspective, this is neither a tribute to the friendly skies nor a reminder of what it's like to fly, thankfully. For me, it calls attention to the fact that we have limitations. And like many of you listening who are healthcare providers, I got into the healthcare profession because it feels good to help others. And this whole notion of taking care of number one first can sometimes feel at odds with our mission. So compassion satisfaction, which we learned about, is centered on giving and helping others after all. Next slide, please. So now let's turn our attention to the image of the fire. Fire is a powerful phenomenon, so is compassion satisfaction. And guess what? So is burnout. The point I'm hoping to drive home here is that we want to respect the awesomeness of our profession as healthcare providers. And we also want to respect our needs as individuals, as mothers, as daughters, fathers, sons, husbands, wives, dog owners, friends, etc. And when we're feeling burnt out, it's much more difficult to assert ourselves, to problem solve, to cope effectively. It's harder to find a calm, rational place from which to operate. Now, I hope everybody is able to hear me. I just got an alert in the chat that maybe I'm a little hard to hear. Is this better?
You're coming through clearly.
Oh, okay. I just got an alert from the chat. So I hope whoever that person is, they're able to hear me a little bit better now. Okay. So next slide, please. So as healthcare workers, as many of you know, we are prone to burnout. So let's be mindful and vigilant of this. We don't want to get too close to the burning flame, and we don't want to put out the fire. We want to keep the fire burning. Next slide, please. So as we have learned a little bit about, and I'm going to go into a little bit more detail, self-care can serve as a buffer against burnout, as a buffer against compassion fatigue. It can help make things better for us, for our patients, for the people in our lives who love us. I think a key takeaway from this slide is that self-care is an activity that we deliberately do in order to take care of our mental, emotional, and physical health. Self-care is a choice, and it's our responsibility. I like to think of self-care as actually part of performance. So it's something that helps us do our job or jobs better. It's not something that takes away from our to-do list. Next slide, please. Now, I think it's difficult to discuss self-care without touching on the concepts of mindfulness. Mindfulness is all about awareness and about not being judgmental. Self-care requires us to be aware of our internal needs as well as the external demands that exist in our lives. And let's face it, there wouldn't be the care and self-care if we were to judge, after all. Okay, next slide, please. So don't just take it from me. There's a growing body of evidence to support mindfulness-based interventions, such as some of the ones we're going to delve into. And if I haven't mentioned it already, self-care is an intervention. Next slide, please. So what are some of the ways we can go about practicing mindful self-care? Well, one way is to begin with an assessment. We can collect data. How are you doing with self-care? The Mindful Self-Care Scale is a validated and standardized tool for assessing the variety and frequency of self-care strategies. And for those of you who are interested in learning more, I highly recommend that you go to Dr. Catherine Cook-Cotton's website, and where I believe you can access the scale. There are 2 different versions, and take it. Okay, next slide, please. Now, on to some of those self-care strategies. So the strategies listed here, in kind of a colorful fashion, were taken from the Mindful Self-Care Scale. And next to the strategies are the corresponding domains. So here we see I drank 6 to 8 cups of water, listed as physical care. It's an example of how we can take care of ourselves physically. I spent time with people who are good for me. It falls under the supportive relationships domain. I engaged in supportive and comforting self-talk, self-compassion and purpose domain. I really like this one, the fourth one. I reminded myself that failure and challenge are part of the human experience. Self-compassion and purpose. This one, the last one I could work on today, I'll add that to my list. I kept my work area organized to support my work tasks. So I'll turn that into a goal. Next slide, perfect. The self-care calendar. Thanks to my best friend, Maria Nanova in California. She created this as a part of a self-care challenge at Kaiser that she is doing with some of her colleagues. So this is just an example, and I invite you to take the self-care challenge. Some additional self-care strategies are listed here. For example, write down 3 affirmations. Social media detox day. That could be on the 29th, or it could be tomorrow for you. Doing something intellectual, like taking this workshop. That's on the 10th, or again, it could be tomorrow. So I encourage you to turn these self-care strategies into goals, and in doing so, I hope you have some positive experiences, and at the same time appreciate that you are protecting yourself from burnout. So let's go to the next slide, please. I like this song by Smash Mouth. I don't know if any of you are familiar with this band. It's a cool song. Somebody once asked, could I spare some change for gas? I need to get myself away from this place. I said, yep, what a concept. I could use a little fuel myself, and we could all use a little change. So thank you all so much for listening, and I wish everybody good luck and good health, and thanks again, Madeline, for the experience.
Thank you both so much for such engaging presentations. We've gotten a couple questions. One was, if somebody is lacking in empathy, what can be done to help develop that skill? Because at the end of the day, empathy is a skill.
I can take this one. If that's it.
Yeah.
Can you hear me okay? I think practicing active listening is a way to convey empathy and to actually experience empathy. You practice repeating what the other person is saying almost verbatim. Oftentimes you see active listening skills practiced in couples treatment, but I think it certainly doesn't have to be limited to couples therapy. And as we're talking about it now, I'm going to try to practice some active listening skills with my family later today.
Great. Another question we got was, somebody had set up a free support group for healthcare providers and first responders during the COVID crisis. And they sent out invitations to hospitals and nursing homes and first responders, and no one has actually participated. And they were wondering how, as a non-healthcare provider, you can get healthcare providers to engage in some of these self-care options outside of the workplace.
So I'll actually say I've heard that from a number of people, that online support groups haven't really taken off all that much. I myself lead a suicide loss survivor support group where we had the same cohort of people who met monthly for years. And since moving to a virtual format, people don't show up. And we reached out to ask, why is that the case? For some people, it's not wanting to use a computer. For some people, it's feeling like this is too personal of information to engage with online. For others, it's, I'm at home and this is my private space and I don't feel like I can have the confidentiality I need to have this conversation. I have other people in my living environment who aren't comfortable with me participating. For others, such as myself, I've heard, I'm online, I'm virtual all day, every day. And so I don't want to spend any ounce of my personal time on screen. And so I think there's a number of challenges to doing online virtual support groups, regardless of whether it's for healthcare workers or first responders or others. So I don't think that is exactly the answer that you were hoping for. That would inspire some optimism, because I don't have a clear-cut answer. I just want to reiterate that you're not alone in having troubles connecting online around such issues. I will say, for our compassion resilience work, though, we have not wanted for participants in any of our online groups. We have started to do virtual groups, especially for parents and caregivers. And it's just taken off like hotcakes. And so if you think that might be an alternative to connect around some of the issues you may have otherwise done with your support groups, would suggest you reach out, and maybe we could do a tailor-made one for first responders.
That's great.
Great. Thank you both so much. That's all the time we have for today. The recording and slides will be emailed out to all of the participants, along with information about how to receive a certificate of attendance within 5 business days. Thank you all so much for attending.